Now to Laura Windsor with this report.
In order to find if therapies are safe and effective in treating diseases, a clinical trial is initiated. The Los Angeles Biomedical Research Institute conducted the Women's Health Initiative, a series of 4 clinical trials and observational studies which involved over 160,000 menopausal women in the United States. Here with the findings is Dr. Rowan Chlebowski.
So the Women's Health Initiative is a series of 4 clinical trials and an observational study which involved a total of over 160,000 postmenopausal women in the United States. These women were recruited from 1993 through 1998. We're still following them. The total direct cost of the entire project done at 40 U.S. clinical centers 2 years ago passed $1 billion. We'll talk about the hormone therapy trials. 2 separate trials, one with entered 16,000 women receiving estrogen plus progesterone. They had uterus, and so they needed the progesterone for protection. Additional 11,000 women were treated with estrogen alone or placebo, and they had prior hysterectomy for cause, which is about a quarter of U.S. women have. And we followed these patients out, these women out, and at the time the study started in 1993, about 30 to 40% of postmenopausal women in the United States were taking hormones with the belief that it was going to be good for chronic disease risk reduction, for heart disease, for cognition, besides bone, and especially for heart disease. But it had never been tested, and so this was the first testing, and when we reported the results, started in 2002 and continued for a number of years, that actually estrogen plus progesterone and estrogen alone weren't good for you, actually had some adverse effects. It really was a kind of a clinical practice changing around the world. So the use went from 30 to 40% to maybe 5 to 10%, dropped 70 to 80%. Most common use for hormones would be for climacteric symptoms, that is symptoms associated with menopause, hot flashes, night sweats. Also, women were taking it to reduce chronic disease. In observational studies, we really can't tell, but about 30% of women in the United States were taking it. In the clinical trial, we showed actually that instead of heart disease being decreased, it was actually increased, and breast cancer was increased substantially. We knew that estrogen is a driver of breast cancer. We just didn't know that it was such a strong driver. The effect on heart disease is a little harder to explain. I think the concept before was that it was going to be good for heart disease because it reduced cholesterol levels, but actually it did a number of other things that really weren't so good. Hormones influence breast cancer, they influence endometrial cancer, they influence lung cancer, so we've had a number of reports on all these different kind of parameters. Once we began reporting these results, beginning in 2002 and subsequently, a lot of medical controversy ensued, which actually still continues to the present time. I mean, there's some people that still would think that for some reason it would be that estrogen plus progesterone still seems to be good for you. And so the controversy continues now. There's a little bit of a dichotomy even today. If a woman goes to an internist, she'll get one story. She'll get a slightly revised story if she goes to a gynecologist regarding the same question. Certainly, menopausal hormone therapy are necessary for some women who have severe climacteric symptoms. Some women can't function, can't do their jobs. Estrogen plus progesterone was introduced at a time the FDA had not strict requirements for showing safety and efficacy. So then claims could be made based on observations rather than clinical trials, and that happened over several decades. And then people didn't want to go back because this observational study had accumulated such a weight that they didn't want to go and do an randomized trial. Of course, nowadays it'd be much less likely to happen because if you want to make a medical claim, you need randomized clinical trial evidence. We're doing not only the clinical trials, which we're continuing to follow those individuals now with an average of about 14 years of follow-up, but we're actually initiating new studies as well in that same population and doing a lot of molecular work in that same population to identify kind of risk factors for chronic disease.
Clinical trials have proven vital in determining the effectiveness and validity of certain therapies for women, so make sure you get all the facts. I'm Laura Windsor for the American Health Journal.